Welcome to the podcast for healing neurology, where we talk about everything that can help heal your neurology, which is really everything from food, lifestyle, and medicine to nature, culture, and politics. There's no topic too big or too small. I'm Jillian Ehrlich, family nurse practitioner, certified in Ayurveda and functional medicine, coming to you from Neuroveda Health, our clinic here in Seattle, Washington. And we have a really, I should say far out, just to set the stage. For a conversation about psychedelics, we have a fantastic guest today. Dr. John Moos is a trauma healer and a medical doctor. After receiving his MD in 2007 from University of California, Davis, he went on to complete his general surgical training at Keck School of Medicine at USC and Los Angeles County Medical Center. Over his 2-decade career in medicine, he's had the distinct privilege of helping and healing those in need. He's been a conduit in saving of human life and witness to the compassionate ending of it as well. He's felt both the figurative and literal spilling of blood of people touched by the hands of hate and trauma. Throughout this time, he confronted and endured the greatest challenges of his life and was gifted the opportunity to face and heal his own trauma. After dedicating his life to the art of medicine, he's been called to put the scalpel down and find a new way to heal. He's vowed to carry this insight learned and earned to better humankind. In 2021, he founded Los Angeles-based Moos MD, which is you can find at Moos, MOOSMD.com, on the idea that healing trauma is an inside job. Blending psychedelic and somatic healing practices, Moos MD aims to catalyze transformative healing experiences by offering comprehensive and custom treatment programs for individuals, couples, and groups. Their work is to create the space, the safety, and the opportunity to heal with a connection-based, trauma-informed approach. Leveraging new medicines, precise skills, and pragmatic healing framework, they guide you through your own process of self-discovery and personal transformation. Dr. Moos and his team recognize it is time to birth a new paradigm of healing and love, and at Moos MD, psychedelics are at the forefront of pushing this evolution. Find out more about him and his offerings at moosmd.com. Welcome. Oh my God, we're so excited to have you here.
Thank you.
So let's just start out. We already got talking before I hit the record button, but it's so fascinating. So tell us about yourself and your transformation from trauma surgeon to psychedelic maven, because that is an uncommon story.
Yeah. So I get that a lot. And so one of the things I always share is, I started out on this pathway to become a doctor. And when I look at the origins of why I became a doctor, you can already start to see that there was shaky ground. And I started out as a high school student who barely graduated. I was in the wrong crowd, doing the wrong things. And when I hit college, I actually started to focus on my education. I became super passionate about marine biology. And after getting accepted to a university in Australia, James Cook University, studying on the Great Barrier Reef, my dad was very prudent about his financial analysis. He's a financial advisor. And so we ran the numbers. He convinced me that it would not be a good financial decision to go accrue a bunch of debt in a foreign country and be stuck in a lab. And so I backed out of my decision to pursue marine biology and tried to figure out what I would do with my biology degree. I knew I didn't want to be in a lab. I wanted to be around people. And so I naturally transitioned to medicine after taking a job as an EMT. And so I loved medicine. I loved figuring out the understanding and the workings of the human body. I absolutely loved surgery because I got to use my hands and have a direct impact on somebody immediately. And I loved the excitement of being in trauma situations. I've always been somebody who has moved towards instead of away from trauma. I don't particularly feel averse to the discomfort of human emotion, human pain and suffering. And if anything, I prefer to be in those moments to provide comfort, safety, and support. Mm-hmm. So as I went through training at USC LA County, I took an academic job there for the first year. And then I eventually transitioned into community trauma surgery. And so I was surrounded by and witnessed trauma in its variety of forms. I saw physical trauma, the impacts of trauma on families. I saw the impacts of trauma on lifestyle, addiction, alcoholism, car crashes, shootings. And these things aren't isolated events. They usually happen in a container or environments where there is, adverse childhood events or experiences, there's trauma. And all of that is underneath the surface. We sort of treat the symptom of that expression. And so I got to a point where it became very difficult to be in alignment with who I was And who I was somebody who had gone through his own pain and suffering in his own life, dealt with his own traumas, and ultimately decided that there had to be a different way to help people heal. And so I had met a woman who's now my wife. She and I were talking, and she had said, I wonder if there's a way to heal it before it happens. And that started the quest or the thought or the curiosity of how can I take my lived experience? How could I take my medical training? How could I take all of this and apply it in a new way? And so through my own experience developing a relationship with plant medicines, I ended up transitioning into discovering and exploring what psychedelics meant and how they could be applied to healing. And so I trained with a variety of institutes. I trained with the Psychedelic Research and Training Institute, or PRATI. I trained with the California Institute of Integral Studies, and I trained with the MAPS MDMA protocol with Michael and Annie Mithofer, and started to develop evidence, support, education, disciplines to be able to offer this in a way that follows the legal landscape with the scheduling of certain substances, but also in a way where I could apply my medical training and my lived experience to help people in need.
Oh my God, fantastic. What a journey.
It's been interesting. There have been, when I say it that way, it feels like a neatly packaged story. I would say, and my wife would probably testify to this, but there were many times where I was questioning what I was doing. There were many times when I felt lost. There were many times when I felt like I was trying to open doors and they just weren't opening. And the more I let go of the need to have the immediate answer, the more sort of cookie crumbs or breadcrumbs I was able to find and follow when I wasn't in my head trying to make it happen. I sort of dropped down into my heart and just sort of felt where I was being called to. And one of the things that was very, very true early on was this idea of how can I let my suffering be for the betterment of humankind? And that has been sort of this resounding call. And then this other sort of saying that I've had in my head is, how can I let my pain be an invitation for others to share their pain? And so a lot of what I do is about connecting to humans and sharing human stories, sharing human experiences, and sharing our humanity. But I've worked on a writing arm called Dear John MD, where I was able to share sort of the messiness of human stories, not in a way of judgment or criticism, just exploring topics in a way to build language and understanding around complex, nuanced topics. And so I love sort of exploring human stories. I love exploring pain and suffering and trying to get to a place where we can start to, reset our foundation or rebuild our houses or create healing when it feels like there is no hope or no pathway forward.
You can really hear in your story, there's, your interest in trauma, literally the work that you do, but also in kind of diving into your own mind and swimming around in there. Mm-hmm. It's a mirrored faction of inside and outside, that you're in the water as you're teaching others to swim.
Yeah, I think that it was interesting. So I was talking to some colleagues recently and trying to figure out what one event, or were there multiple events, or where does my healing framework come from? And I'd say the thing that informs my ability to hold space and help others heal, because I don't heal anyone, I create space for people to heal themselves. I would say that the most important piece is my self-healing journey and my co-creation of the relationship I have in my marriage. And that has taught me how to sort of infuse myself with self-love and integrity, but then to partner with another person. And relationships are one of the quickest way to access consciousness. You see a mirror in front of you. You see all your patterns. You see your vulnerabilities. You see your reactions instead of responses. You see all of that in the context of a relationship. And so we call our relationship a co-creation because it's something that we consciously bring in together. And it's something we consciously work together to make each other better people.
That's so interesting. There's Dr. Vasant Lad, my Ayurvedic teacher, always used to say, to know one science of healing well, you actually have to know two. Because if you need to have a leg somewhere else in order that you can understand where the first leg is standing. And so I have not thought about it before, but you're exactly right in terms of if you're going to know yourself, you really have to know. You have to know another, and certainly humans not always have one partner, but, we definitely are a species that has historically had, has had kind of a dyad type of social, I don't know how else to say it, social cueing.
Yeah, no, I think that makes sense. And I'm going to say a quote, and I wish I could attribute it to the correct individual, but the quote is that, trauma is created in relationships and needs to be restored in relationships, needs to be healed in relationships, because trauma in and of itself is generally a response to an event. And trauma typically happens when you're left in isolation. So it's the absence of somebody to help you process that moment that creates the trauma. And I see it all the time with people who come in. They're like, well, I had a great family, I had a great upbringing, I had everything I wanted, but I'm still like noticing this pattern. This thing keeps coming up. And I have to remind people the ways in which trauma is defined. Trauma could be as subtle as a misattunement, right at the critical moment. Yeah. And that could create the inward negative self-talk. It can create sort of the snowball that starts to gain evidence, and you start building your own case against yourself. And left unchecked without somebody to help you navigate that, who has the skills to be able to, sort of let that breathe and integrate and process and make, meaning out of it, trauma will develop.
So interesting. And I think that we're trained, like if your kid is bad, you put them in a timeout by themselves, you send them to their room. And so here is a kiddo who may have absolutely done something that was, not right, but is now being left to their own devices to kind of work it out or suppress it so that they can rejoin with a smile on their face.
Yeah, I remember this fable of an indigenous story where when somebody has done something, somebody is addicted, somebody has hurt another individual, what they do is they actually sit them in the center of their village, their tribe, and they create a circle, and they sit and circle together until that person is healed. So the idea is that you're not left alone. So there is, and I'm guilty of it. When I had my daughter, I remember one time I put her in a timeout. She was screaming. And I remember my heart hurting. And I thought I was doing the right thing. And then shortly thereafter, I was like, this is not the right thing. And I ended up going back in to sort of reconnect that bond, because her crying was a bid for affection. And what I was doing was withholding the love she needed. Yeah. And then, I can dive deeper into this, but then what is she doing that's right or wrong? Is it my judgment? Right? Is it my opinion that what she's doing is wrong? Is it an inconvenience? Because that's my issue, not hers. And so learning how to navigate my interior environment has helped me to be a better parent in those situations. But I think it is really important, in times of stress or in times when there's sort of discipline needs to be created. Oftentimes it's a matter of defining the boundary, and it's about approaching the situation with curiosity. So I've done this a lot now. It's just like, hey, I noticed this happen, or hey, I noticed you did this after I told you not to. Like, why did that happen? Why did you do that? Why did that happen? And it gives them an opportunity to be involved in a conversation as opposed to being punished, because I don't think punishment has ever been shown to create long-lasting effects.
Yes. I've tried using shame therapy only with my young son when he was eating his boogers. I was like, oh my God.
I read the weirdest article today. It's so funny you said that apparently picking your nose can cause late onset Alzheimer's. And I'm like, that has to be a correlation, not causation.
Who figured that? Who did that study?
I have no idea. It was on I have a Pixel. I was on a Google headline. I was like, that is weird. And I was about to click on it. I'm like, I don't want to know.
That's hilarious. Well, and here we are. I mean, this is a really interesting conversation in itself. And our podcast topic today is actually about ketamine or psychedelic space. So as we know, to know oneself, it can be enlightened by being in relationship. So to know one's consciousness, or this is at least how I have thought about it, but I'm really interested to hear your take. To know our consciousness is one of the main benefits of using psychedelics as a therapy, because it allows you to step into a different consciousness in order to potentially gain perspective on this consciousness in which we live. So I'm curious your thoughts about that. And let's dive into kind of the conversation around like, what are psychedelics? What are they doing?
Yeah. So the conversation or the topic of consciousness is sort of limitless in its understanding and its explanation. So I'll try and keep it in a contained way where we can at least talk about psychedelics. And so without really understanding, in my mind, what trauma is, it's hard to really understand the benefits of psychedelics. And so I say to individuals who are coming in for a consultation, anybody in a human body is subject to the human condition. Mm-hmm. Anybody in a human body is going to have trauma, some form of trauma, perceived, real. It's real to that individual, because trauma creates typically dissociation. And dissociation is an event where we take the situation or the context and we compartmentalize it, because the external circumstances are overwhelming our internal resources. Mm-hmm. And when we can't deal, we still need to survive. And so our body and our mind is incredibly adept at saying, I'm going to package this and I'm going to put it aside because I am not in a position to deal with this. I'm either unsafe, I feel threatened, dysregulated, any of the mechanisms that we do to sort of survive situations. So what happens is we grow older, those compartmentalized, dissociated events in our life separate from our autobiographical timeline. So when we can recall, when I was 6, I got this present, and when I was 7, this friend. When it's dissociated from our timeline, we have these events, these triggering events. It could be a scent, it could be a cue, it could be a volume of voice, it could be a certain season where it triggers that event and we feel flooded, completely flooded with all of the experiences there because it doesn't have a place in our timeline. And so the iceberg is a perfect example of consciousness, right? So you have water and the iceberg. The tip of the iceberg is sort of what we're aware of, right? We have this perception of, okay, I have these things in my head. I know where they are. I know these memories. I know these events. The water is the line between our conscious and unconscious mind or subconscious. And then the base of the iceberg is sort of what's underneath there. What are we not aware of? And these trauma events, we eventually get so good of coping with them, or maladaptive coping, meaning coping in harmful ways, that we start to be guided in life by what feels like invisible forces, an inability to have freedom of choice, an automaticity in what we're doing. And so we're sort of feeling like, I don't feel like I have a choice, or there's no way, there's no other options. We have this sort of narrowed, tunneled vision. And so psychedelics, what they do is they're a tool. And I purposely call them a tool because there are a variety of different tools, breath work, yoga, ecstatic dance. So consciousness accessing, consciousness expanding tools. And psychedelics are one of those. They can do it, they're catalysts, so they can do it rapidly and quickly, but they allow you to go from your conscious mind, dive deep beneath the surface into the subconscious and have a deeper understanding of these circumstances, events, or moments in our life that are impacting us in the present time. Now, pulling all of that up from the water, pulling up, and I'm going to use Rosalind Watts. She says, diving into the depth of your conscious and then bringing up these pearls as part of her ACE integration platform. But bringing up these pearls, you then have to figure out what they are. And that's when the work starts. So you can take a psychedelic, you can dive into your subconscious, and you're making unconscious material conscious. Mm-hmm. So bringing your awareness to these events, bringing your awareness to these traumatic events in your life will give the individual the opportunity to then integrate, which means to find and assign meaning to them. And oftentimes you can't make meaning out of something until you've processed it through the 3 lenses of understanding, which is cognition, your head, somatic, your heart, and embodiment, your intuition. So this alignment is imperative, sort of processing this information and allowing it to then say, okay, I've re-experienced all the feelings. I understand all the pieces. And I now know that this was, not my fault. It was circumstance. I was not the bad kid. That shame is not mine. And then you can pull it in and say, I have meaning from this event now. I don't condone it, but I understand it at least now. And so you develop a new relationship and a freedom from it impacting you with its invisible hands.
My God, that's fabulous. Everything you just said was fabulous.
So that is, I think, the simplest way to describe how, or at least how I use and relate to psychedelics and how it can help with healing.
Okay. I'm thinking of multiple ways to move forward because there's so many interesting things on so many levels. Part of what we were talking about even before the show was that what both of us have been really impressed with in terms of the Psychedelic Research and Training Institute, PRATI, where my training comes from, where one of your trainings comes from, is that, you are still the medicine. The person is still the medicine. The ketamine or whatever else is used, the substance is the tool, but that we are truly who we are and how we understand ourselves changes our physiology. It changes our experience, it changes our meaning, and it changes our physiology. So when we talk about what are the conditions that are appropriate for treatment with CAP or ketamine-assisted psychotherapy or psychedelics, can you talk a little bit about who is an appropriate person to consider this type of experience?
Yeah. So I'll sort of hit on 2 buzzwords and then dive deeper into it. So who is it applied to? I'm of the belief that anybody with trauma can explore psychedelics. What are people legally allowed to do? So looking at sort of what's been researched and data proven, we know that ketamine helps with depression. We know that ketamine helps with anxiety. We know that ketamine has been used in alcohol use disorder, the protocols around alcohol use disorder. There are some studies about ketamine with OCD, and there are other indications that have been studied, and at least there's data supporting their claim for other mental illness. Then we look at something like MDMA. MAPS has been doing amazing work to get MAPS available and ready and rescheduled by the government to hopefully a Schedule III substance, which means it's prescribable for PTSD. Incredible benefits with their phase 3 clinical trials. We know that psilocybin is being also studied for a variety of contexts. It's being studied for OCD, depression, again, showing benefit. But the power of some of the studies and the reproducibility of them is still, again, yet to be determined. If you look at the microdosing literature, microdosing in self-reporters, there's a recent study out of the University of British Columbia and with Paul Stamets, and that was a roughly 8,500 self-reporters who showed that there were improvements in mood, concentration, focus, and mood, reductions in depression, anxiety, and stress. And that was followed up with the 2022 study looking just at the mental health aspects, and it was replicated by reductions in depression, anxiety, and stress. And so we have these reports that are in the literature, but again, the FDA and DEA is not making claims to them. And so they can be used for these narrow subsets, these well-defined sort of diagnosable situations. But I think that, and I think about this a lot, I think that mental health is on the spectrum of the human condition. So somebody who has subtle anxiety, somebody who has maybe not a full-blown addiction, but engages with something in an unhealthy way, but it doesn't meet criteria for addiction, I think could also benefit from these because it's an extrapolation of the data, but it gets really murky when you start looking at what is required to make something rescheduled, what is required to be able to offer it in a legal way in the current healthcare system. There are many places that get around this, Peru, ayahuasca, Gabon, iboga, the Mazatec in Mexico with psilocybin, peyote with indigenous practices, Native American practices here in the US. Jamaica now has legal, or not now, but has legal psilocybin. So there are ways to get around it. So there are people doing this work. And so I think that the number of people that could benefit from it is vast. Now, the soundbite that I wanted to say initially was psychedelics are not a panacea, meaning that everyone may not get the same benefit out of it. But I think that anybody, to me, it goes back to, can you live a better life if you live an examined life? I think psychedelics give you the capacity to examine your life, your patterns, your behaviors in a way that is like eyes wide open. It gives you full access to be able to explore areas in your life in a really impactful way. But again, there are adverse events, and I think those are limited. And we know that they're limited because of, if you look at the number of people who are recreating with substances, mixing with alcohol, mixing with other, drugs that have no medical benefit, mixing with undiagnosed, things like schizophrenia, bipolar, actually in manic phases of bipolar, because psychedelics can be beneficial for the depressive state of bipolar. But looking at all of those, we have a huge body of evidence to show that these are safe in recreational settings for the most part. There's incidents. But the other thing that I wanted to chime in on in talking about psychedelics is Timothy Leary's comment about set and setting. That's widely used now as, the right conditions to give psychedelics. And I think that the way that I like to differentiate set and setting so it doesn't just feel like a buzzword that we're throwing out is I like to think about intentional introspective work versus recreational use. And that is what set and setting is addressing. But the way I like to describe it is recreating with psychedelics is really creating an externalized experience with psychedelics. You're interfacing with people, you're sort of at the whim of the music, at the whim of the crowd, whatever's happening around you, the people around you, if somebody's crossing your boundaries or respecting your boundaries, all of that is sort of a variable that you now have to control in a non-ordinary state. But when you're doing intentional introspective work, you make sure that you have a safe container. The experience is intended to be an internalized experience to better understand your internal environment. to resolve internal conflict, to reduce ego boundaries and soften ego boundaries. And again, all in a way to better understand yourself. And so as we, say, the medicine is the medicine, but the medicine isn't all the medicine. The medicine is a tool that accesses consciousness. The environment you're in, the safe container that you create with the practitioner or the facilitator is part of the medicine, but then also your relationship with the facilitator who is guiding you through. If this is somebody you don't know in an unknown place that feels unsafe, you will have that energy infuse your experience. But if you're with somebody you trust, who's provided information, who's named variables, who's reduced anxiety, and it's in a warm, comfortable environment with soft textures, that will support the experience wholeheartedly.
You talked about a number of different substances, ketamine, MDMA, ayahuasca. Can you talk a little bit about what psychedelics do in our body or in our brain? Like what is happening physiologically, and kind of what are the differences between those substances?
Yeah, so ketamine sort of gets lumped in there, but ketamine is not a traditional psychedelic. It's an NMDA antagonist. So the mechanism is not completely well understood as far as why you have these mystical experiences. There's a lot of theories. There's evidence to support why it has an antidepressant effect, because it impacts the lateral habenula, the burst firing pattern of the lateral habenula. And then you have other ones, the phenylethylamines and the tryptamines, which are sort of the classic psychedelics, which are, ayahuasca, iboga, peyote or mescaline, San Pedro, hachuma, MDMA. MDMA is sort of lumped in there, but MDMA is not a traditional psychedelic. Psilocybin and, a variety of other substances. And MDMA, I'll differentiate because MDMA has two parts of MDMA that make MDMA impactful, especially for PTSD. It has a component that is sort of termed an empathogen, meaning it creates this very heart open space. But then the amphetamine, because it's methyl-dimethylamphetamine. So MDMA is methylene dioxymethamphetamine, and it has an amphetamine group. And the amphetamine group is actually really important to creating an activation. So the way it works is and again, the mechanisms, these are not completely understood, but what we do know is it hits the amygdala, it downregulates the amygdala. It allows you to talk about and process trauma without launching into a dysregulated state, which is full-blown sympathetic response, which can be fight or flight or freeze and submit. And if you're in a dysregulated state, you cannot cognitively process any information. You just shut down. So what it does is it reduces your fear center through your amygdala, brings you back to a regulated state, and then it gives you the energy and capacity to do it in a heart-centered space. You could not design a better drug to work through PTSD. Wow. And so then you look at other psychedelics, and apart from the pharmacology or sort of looking at the structure, which are again, all sort of serotonergic molecules in which they activate sort of the psychedelic receptor is the 5-HT2A receptor, but there's multiple serotonergic receptors in the brain. And it activates that 5-HT2A receptor and it creates this psychedelic effect and experience. With MDMA, it does impact the serotonergic system, but what it does is it actually causes an efflux of neurotransmitters, so serotonin, dopamine, and norepinephrine. So that's why sometimes after MDMA, you can have a sort of a fatigue that occurs because you're reducing or you cause an efflux of neurotransmitters, and so you deplete your intravesicular stores.
Oh, okay. So there's kind of like a letdown period while those re-up again. There's a supply chain issue.
Yeah.
Very like of the moment.
We're very familiar with supply chain issues post-pandemic, yes.
These substances really do have a lot of different types of ways that they impact the brain.
Yes. So different ones have different ranges. So I don't know if this was anecdotal or if this was evidence-based, but LSD has the most serotonergic activity. It activates more serotonin receptors, which is theorized why it's such a visual experience. And it doesn't mean it's better. It just means it hits different. It has just a wider spectrum of effect when we're looking at receptor affinity.
And so there is something in medicine called a serotonin syndrome. So why does LSD not trigger, or does it trigger serotonin syndrome, which can be dangerous, right? Serotonin syndrome in its full can be very dangerous. Yeah.
So interestingly, and I'm going to give him full credit because I think he's absolutely brilliant, but Ben Malcolm, he goes by the name of Spirit Pharmacist. The guy is absolutely brilliant. He put together a drug interaction, psychiatric, and MDMA, psilocybin systemic review. It's like a 30-page article that I need to read, but he has handouts, and he gave a recent talk through Psychedelic Support, the website. And we were talking about this idea of serotonin syndrome. And I actually just heard Rick Doblin speak about serotonin syndrome as well. And there is a growing body of evidence to support that the concern for serotonin syndrome may be disproportionate, meaning that the concern is greater than the actuality. From what I have read and what I understand, serotonin syndrome occurs predominantly in things that cause an efflux of serotonin. So MDMA with things like SSRIs or antidepressants, selective serotonin reuptake inhibitors, and things like monoamine oxidase inhibitors. And the reason being is when you have something that prevents serotonin from being broken down in MAOI, something that prevents it from being taken back up into the cell in SSRI, then you have something that causes an excretion of serotonin, MDMA, that sort of trifecta can create unsafe amounts of serotonin in the brain, which can cause serotonin syndrome, which can be seizures, flushing, life-threatening. With psilocybin, it doesn't cause the release of things like psilocybin. It doesn't cause the release of serotonin. It activates the receptor. So generally, if you have something like an antidepressant or an SSRI, and you take psilocybin, there can be a competitive binding at the receptor. So you may have a dampened effect and not have the full-blown sort of experience that you would have if you were to have psilocybin without any SSRI into your system. And so one of the really interesting things that he proposed is, why are we putting people on, medication or agents that prevent other medicines from working first line? Like, we should be offering people ketamine, psilocybin, MDMA first. And if it doesn't work, then throw them on an SSRI, because being on an antidepressant can inhibit or reduce the efficacy of other treatments. So all of these things are being studied. There have been studies looking at the effect of psilocybin while taking an antidepressant, which showed that my favorite paper was by Robin Carhart Harris and Rosalind Watts that talked about psilocybin creating a sense of connection and antidepressants creating a state of disconnection from life and from our environment and our internal environment. And Rosalind Watts is like such a badass. She has this Watts connectedness scale, and the elements are connection to self, other, and nature, the universe. And so she's like one of her big focuses is connection. And so for her and Robin Carhart Harris to have studied this and look at psilocybin as its ability to create a sense of interconnectedness, and SSRIs or antidepressants to create this state of disconnectedness, what we're looking for is integration in our life. We're looking for integrations in ourselves, integrations with communities, others, and a sense of connection to a greater purpose, meaning, something bigger than us, the universe, nature, God, whatever it is for each individual.
It's so interesting because the connection piece, how many times have we seen, so disassociation, as you said earlier, is a coping mechanism, a maladaptive, but in the moment can be really relevant. So if you're a 3-year-old and your mom can't be around you if you're crying and you're upset and you're hungry, you know that you need to shut that shit down in order for that survival piece, for that to stay in the cave. Yeah. And so if SSRIs, that might be that little use for SSRIs in terms of disconnection. If you being connected to your trauma is overwhelming, then having a period of time where you're disconnected may be a way to kind of move forward with your life and make changes to get out of a dangerous situation. Or I think that it's not that any of these tools are the good or the bad, but it's about how do we use them. So if we know that an SSRI is going to be and what's classic about this is that ketamine, for example, is considered a dissociative drug.
Right.
And SSRI is considered like an antidepressant, like you're no longer depressed, so now you can connect with people. But ultimately, what the short story is what are you connecting and disconnecting from? If you're disassociating from your trauma, you can plug back into like the ocean of consciousness from which we all rise out of. And so you can actually disconnect from that tiny little, as we were talking a little bit before we got started, we have this ego identity that we do need because my body needs to know out of my digestion, it picks up substance A and it doesn't need the nutrition of substance B. It doesn't need FD and C number 5 from all those Skittles I ate from from Halloween. So, we need to have some level of ego to know what is safe and not safe for us, even metabolically and cellularly. But if we can disconnect from the trauma piece, then we can reconnect to the universal piece. And maybe the way to use SSRIs moving forward is to actually give people somewhat of a mental disassociative break so that they can get themselves life-wise into a better situation to then be able to manage that trauma. You have to get to, when, like I tell a lot of families with young kids, the goal is not that when your kid stubs their toe in the library as a little one, you scream out. That's what our natural instinct is. And the goal is not that they never scream, but they have options that they can hold it for that temporary period, and they can walk outside into the street and then scream their head off as a way of discharging the distress of that pain and that fear and, that sensation in order to heal. And so it's so interesting to consider what is disassociative and what is associative as we move forward.
Yeah, I think you hit the nail on the head, and I really want to sort of support what you said. It's not about labeling anything as good or bad. I'm not here to tell anybody that their pharmaceuticals or their medications are terrible, because, and I counsel people on this, they're like, well, should I be on antidepressants? And I said, listen, antidepressants were intended originally to be temporary ways to help you resolve your external stress, right? If the external stress was creating an overwhelm of your internal resources, the idea was to give you support externally and then provide therapy, change of conditions, whatever is needed, or skills and behaviors to bolster your internal resources to match what you're facing, so then you can come off of the medicine. And I think what's happened is there's been sort of this, well, I don't really know, you seem like you're depressed, I'm just going to throw some medicine on you. And then it's just like, you set it and forget it. And I think that anything in life, when we're talking about humans, where you set and forget, is prone to be, I don't want to say negligent, but
I was going to say abusive. That's what came to my mind.
Negligent or careless, right? It's just, we're not looking at the person underneath the story. And it's not to say that like the goal is to get everyone off medicine. The goal is to get everyone to feel like they're their best version of themselves. And if somebody is their best version of themselves on any amount of medication, then amazing, right? That's what I think ultimately everyone wants, is to feel seen, heard, valued, and live their fullest expression. And if medicine can do that for people, then great. But I also think that, I have been scrutinized for not me personally, but like as a provider, you're scrutinized by your ability to provide an informed consent. Like, are we giving everybody the full information when we start them on things? Are we cherry picking the story that best supports how we can give them something and get them out of, move them on? And so that is just the thing with SSRIs. I always want to be mindful of, like, what are we really supporting here? Because there's plenty of studies that have shown that exercise is equally as efficacious as SSRIs. There have been plenty of studies that were completely submerged that showed no effect. It's not talked about when you take long-term SSRIs that you downregulate your receptors over time. So you have less serotonin receptors. And if you're on an SNRI, you have less receptors to do the same amount of work. So when people come off of SSRIs, they oftentimes go through terrible post-acute withdrawal syndrome, terrible withdrawal from their SSRI, to the point where they feel like they have no control of their body, their internal state, their external state. And the last thing I would say, and I know this just from my own personal experience of hitting a rock bottom in my life, is if I didn't go to that low, then I wouldn't know the sort of polar opposite, which is the high. And one of the things about antidepressants that I think is important to know is that it's sort of like a governor where it limits your range. It's like, okay, you're not going to cry all the time, but you're also not going to feel that laugh out loud belly laughter joy, right? It just sort of truncates your experience. And there's this great book called Peaks and Valleys. And what they describe is the valley is where you learn about life. The peak is where you appreciate life. Right? And if you're just on a narrow sort of rolling hill landscape of life, you enjoy it. But are you just getting the most out of it? And again, those are the questions that I like to think about and explore, because again, my goal and my interest is in getting people to have freedom of choice and self-express in their highest version.
If you're enjoying the show, please be sure to rate and review this podcast and share it with your friends. We want to keep our podcast commercial free and continue growing our educational offerings. So here's our itty bitty plug to join us on our mission. One easy way is to buy the supplements that you're already buying through our Fullscript or Wellevate accounts. Fullscript and Wellevate offer high quality supplements. They take good care in their shipping and they vet their brands well. We give everybody a 15% discount across the board because we all need some help in this world. Please go to NeuroVedaHealth.com to our store page to sign up with Fullscript or Wellevate to support us and our larger mission. We are so thankful for your support. I'm asking this slightly facetiously, but is there anybody who's beyond hope? Like if you're listening to this podcast right now and you feel like I can't be helped, I'm actually beyond all of this. I have tried everything. And my depression is like a blanket that has no edges. I'm curious your thoughts about that experience.
So I don't think anybody's beyond hope. What level of impact you may have, though, might need to be assessed. And I think that one of the things that we don't know completely is, can you, and this is a big void because there's been no research allowed or very limited research allowed on these substances for 30, 40 years, is actually, I think longer than that, 50 and 60 years in some, but can we create protocols to sort of heal the most complicated cases? Can we heal the most complicated cases when we still have structures of imbalance and these wild structures that perpetuate imbalances of power? Can we provide medicine to offset some of those communities that are disproportionately affected by trauma, right? So we get somebody into their highest self, but we put them back in structures or systems where the conditions in and of themselves are toxic. Right. So I don't know if we can sort of heal the most recalcitrant sort of cases or difficult cases. But I would say that everything that I know about epigenetics and the impacts of our environment and the impacts on our neurobiology and the impacts of trauma, I feel that we can bring people into a better state of health. Through this work. And I would say through this work, not saying only psychedelics, because I don't want to put anybody's health and well-being into one basket. I think it's multimodality. I think it's multifactorial. And I think it is a task that is bigger than just providing medicine.
I totally agree. 100,000%. There are conditions out there which are inherently depressing. Our inequality, our pollution, our increased rates of cancer, our disabilities, and disabilities driven by external factors. Yeah. And it really speaks to that again, it's that relationship piece, which I love that this conversation keeps wrapping back around to relationship, that none of us will essentially get healed or like become perfect, messy and perfect, whatever that means. None of us will resolve everything on an individual alone, essentially.
Yeah. And, I feel like I have sort of these three metrics that I look for myself. Am I being introspective? Am I accountable? Am I being humble? And I use those to first apply to myself. And so, listen, I created a social channel on this. It's sort of like the gifts of imperfection. It's like just embracing my messiness and the messiness of being human. And I tell my kids this all the time, like, listen, I'm not perfect. Far from it. I have a lot of flaws. And so for me to sort of pretend like I am, perfect in any sense is comical to say the least, but we're not perfect, and we will never be perfect because it's an unattainable ideal. And I wish, my hope is that we can all just embrace our messiness together so we could have a lot more empathy for one another and really a lot more compassion for one another. And again, this goes to Desmond Tutu. He was the first person I read this, but, talking about our shared humanity. And I think if we could just sit there in our shared humanity, we could start to realize, when I think about the number of years that I had sort of negative thoughts about my ex-wives, right? Mm-hmm. They're people with stories. Right. Mm-hmm. I'm a person with a story. As soon as we drop all the stories, like all we are is just people. Yeah. And if we have these complicating stories that I'm guilty of this, that I've brought into my life and I've created narratives and I've done these things to sort of really support my position. And then I had my position and I guarded it. And it's just like, what is this for? Like, we're all people. I try and get to that position when I feel like my vision's sort of tunneling in. It's just like, okay, let's broaden this back out. We're all people, like everyone's trying their best. I love the 4 agreements. The 4th agreement is like, just do your best.
Yeah.
Just remember that.
Yeah. Yeah. We're just mammals on the planet.
Yeah.
If you can imagine like one fox looking at another fox being like, you're red this spring, this summer is just not cutting it.
Right.
Yeah.
So true.
This has been an amazing show. You've reviewed a ton of pretty incredible resources. And what I'd like to hit on before we close today is a little bit about what that process is for, what we talked about, what is legal right now is ketamine assisted psychotherapy or ketamine assisted journey. And so I'm curious if you can talk a little bit about what that process looks like. So if you're an person in the audience listening today, like if you're like, okay, I'm curious about that. What are the steps and what does each step entail?
Yeah, so not all ketamine facilitators, providers are the same. So because I have a trauma surgery background, I do not provide therapy. I do facilitation. I sit with people in integration. I'll explain all this in one second, but I sit with people, but I don't offer therapy. There are providers who prescribe for other individuals. There are therapists who provide ketamine-assisted psychotherapy. They offer their therapeutic services as well as ketamine-assisted psychotherapy. There are psychiatrists and integrative psychiatrists and other practitioners who do have therapy as a part of their medical practice. And so what I would say is there's a variety of ways in which you can access ketamine. The thing that I would say is most important, and this is my opinion, most important is go to a place that focuses on preparation, facilitation, and integration. And the reason those things are important, I'll explain why. Preparation helps you to create safety in the container and start to develop a relationship with your provider and answer questions to name all of the unknown variables. So you have less apprehension and anxiety going into the experience. So it really helps the internal mindset and the internal state. Facilitation, you want somebody who's skilled, who's not just saying, well, I've seen it done on, TV or I read a book, but somebody who has skills to be able to facilitate a safe session. And then the last one, integration, is when you contextualize what's come up in your experience. So if you go to a ketamine clinic and somebody, shoos you in, you do a questionnaire, they hook you up to an IV, they give you medicine, they send you out. You have nobody to help you with that what's been brought up. You have nobody who help you contextualize the experience. And so there is a role for those for individuals with chronic pain who need 4-hour infusions. If there are individuals who, rely on those for whatever means, I think that, again, I'm not trying to malign any group, but I think that there are opportunities missed when you don't have a provider or a prescriber who focuses on preparation and integration, because I think that those two bookends create meaningful experiences and an opportunity to contextualize these experiences. So that's ketamine. If there are individuals who are looking for sort of information on other substances, there is nothing illegal about providing educational pieces. So there are harm reduction practices, there are educational pieces. I consult and advise a lot with people who are going to medical tourism, they're going to Peru, they're going to Mexico, they want to try different substances. I will oftentimes consult and help people with advisement in harm reduction policies. I've told all of my kids, do not take anything off the street. People are getting random stuff contaminated with fentanyl and other drugs, So just going out and sourcing your local dealer for substances, thinking you're going to have this amazing experience, you could end up dead. So there's a lot of safety that is required until these things are produced in a way where we can have reliable sources and be given, legally prescribable. But there's an abundance of information, and just being able to go someplace to be able to access that information is really helpful. And so I'm happy to answer questions for people. Like I said, I've gone through a number of trainings to be able to do that with a sense of education and experience. And there's plenty of people out there that could also help.
Are there any kind of professional organizations that you particularly respect or refer people to for this kind of information?
There are 2 organizations that are looking to create standards of practice and accreditation. Mm-hmm. One is the APPA, the other, I can't remember the name.
Oh, Board of Psychedelic Medicine and Therapies.
Board of Psychedelic Medicine. So BPMT, Board of Psychedelic medicine therapies. And these are new organizations that are looking to standardize and hopefully be viable sources of information. There's websites, Psychable, another one, Psychedelic Support, psychedelic.support. And, there are new places that are sort of popping up. But unfortunately, a lot of it is just accessed through anecdotal reports on websites, which can be biased, which can be sort of made to feel like they're statements of fact, when in fact, they're really just anecdotal reports, which means their own personal experience. So their opinion, for lack of a better term. And again, those are important when you aggregate enough anecdotal reports. So this in science, this is aggregating case reports and doing retrospective reviews and then doing cohort studies, then designing new studies to actually see the efficacy, see what's fact and what's fiction. But yeah, there's a few places I think where people can access some of this information.
Before we close, I also just wanted to check in about the relationship between psychedelics and cannabis.
Yeah. So this may be TMI, but I personally do not enjoy cannabis. I've tried it a few times in my life. I don't like the experience. I don't like feeling paranoid. I don't like tracing. The whole experience to me is just unpleasant. I would say that the most meaningful book that I have read about it was by Julie Holland, incredible educator, scientist, physician, writer. And she's written a number of books. She wrote the book on ecstasy. She wrote a book called Good Chemistry, really just a brilliant mind. And I think that she wrote a book on cannabis as well. But there is some benefit to cannabis. I think it activates some of the 5-HT2 receptors. The cannabinoids have a lot of anti-inflammatory properties. So there's a lot of good science in cannabis. It personally is something that I'm not impassioned about. So I leave that to people who are way smarter about it than me.
Is there any, because it does change the mind. So it's psychoactive, but it's not psychedelic.
Yeah. So it's psychoactive. I mean, I've read reports from, heavy chronic use in pediatrics causes permanent brain damage. Yeah. I've read reports that, that it can cure everything from MS to nausea to, create weight gain and chemo-related weight loss. So I think there's a lot of claims. I think that it's still something that has groups that are trying to malign, so like government bureaucracies are trying to malign them as harmful substances. I think out of fear. I think there is really good evidence to support that they do have medical benefits. But yeah, it's not considered a psychedelic, although it can be a consciousness expanding event. And so Hamilton Souther he's the creator of Blue Morpho, which is an ayahuasca retreat in Iquitos, Peru. Mm-hmm. He talks a lot about using high doses of cannabis to access consciousness and uses it exactly for that. And so I know there are practitioners who are doing that, but that's definitely out of my world.
And so, yeah. And as you're talking, I remember, there's that movie I can't remember that black and white movie, Reefer Madness. And yeah, it's definitely been maligned is a perfect word to describe it. And that also happened with kind of the more classic psychedelic, LSD and Timothy Leary in the 60s. And I'm wondering if you can speak a little bit to, I keep trying to close, we will close momentarily, but I'm wondering if you can speak a little bit to kind of why when research was happening in the 40s and 50s, and then why it got shut down so hard in the 60s.
Well, there's a lot of theories on this. The biggest one is that, when you're looking at an organization or a group of people in the 60s who were counterculture, anti-war, anti-government, and you want a really great way to malign them, you make the medicine that they're using or self-medicating with illegal, and you label them as criminals. Okay. So a lot of it comes from that. Then, Nixon and Reagan, war on drugs. There has been widespread evidence that supports that the scheduling of substances and the disproportionate criminal impact on communities of color has been a structural form of racism. Mm-hmm. And, part of the California Institute of Integral Studies curriculum has been really sort of pulling the veil back on some of these stories that we've been told, or some of the beliefs that we've had, to really explore these stories around racial injustices in communities of color. And so there's probably a significant amount of political motivation to malign groups, to create injustices and balances of power, to create compliance. Which I hate to say because it sort of has me feeling like a conspiracy theorist, but the reality is there's a lot of fact and evidence to support this. And so I think that, I don't know, the government has made sweeping changes in error. And I think that the road to correct those has been long. And so, undoing the processes of the 60s and 70s will hopefully try to correct those decisions that were made in haste or misinformed or maligned, so.
Interesting. When I think about it, what was going on in the 40s, the folks who were kind of coming of age between the First World War, the Great Depression, the Dust Bowl, the Second World War was so horrific. The 50s, better living through science was a lot of emphasis on disconnection for safety.
Yeah.
I think there was so much trauma. There's the patients that I've seen over, my career in medicine, the men who were born in the 40s or born in the late 30s really have been really well trained to not feel things, not feel their feelings, not recognize their feelings.
Yeah.
I think a lot of that was out of safety. And so sometimes I wonder if this is a medicine of connection, that was just terrifying through all that trauma first before you could kind of reach the light.
Yeah, I think that when you give a consciousness accessing or a consciousness expanding agent and you haven't dealt with sort of the circumstances of your development, your upbringing, your family, it causes you to challenge and question everything you know, right? Yeah. And that can be very destabilizing. So I feel hopeful that as these medicines sort of become rescheduled and become options, that we will have more support, more evidence, more education, and more willingness to sort of change our perspectives and our perceptions.
Okay, fingers crossed.
Yeah.
Any last thoughts before we close?
No, this has been wonderful. Thank you so much for the conversation and the opportunity to connect.
Oh, thank you. Thank you for being here with us and for sharing your time and all your knowledge and experience. It's been awesome, very enlightening. Hard to find, I think. Somebody who kind of knows what you know, but also hopefully, the teaching that you do and the offerings that you have will help broaden it. So we're happy to have you. And thank you, everybody, for listening today with Dr. John Moos. We've got lots of ways to continue this conversation through Facebook and Instagram. You can get more information about Dr. Moos at his website, moosmd.com. moosmd.com, and from us on our website, neurovedahealth.com. Please be sure to share this show with your friends. We welcome your rating and review wherever you get your podcasts, and feel free to send topic requests to podcast@neurovedahealth.com. We love that you've joined us today to discuss how to make our whole world medicine. We rise or fall together, and we're committed to doing what we can to make as many of us as healthy as possible. And this takes all of us, including you. Thank you for listening, and we'll see you next time.
Party Fish Media acknowledges that it operates and records on indigenous Duwamish and Puget Sound Coast Salish land that is still home to the Duwamish tribe. This land is stolen in violation of the Point Elliott Treaty of 1855. We are committed to uplifting the name of these lands and community members from these nations who reside alongside us. For more information on this land, its people,